Thank you for joining us again, Keith Tebow, on this snowy day. We like to keep you up to date on what's happening in terms of the COVID-19 vaccines. As of this recording, individuals 75 and older are able to receive and start getting their first dose of the vaccine. We're going to bring in someone we spoke to, I think, just a couple of weeks ago on the activities on how HealthFirst Family Care Center is servicing and distributing vaccines. I'm pleased to be joined by the Chief Medical Officer at HealthFirst, Dr. Eric Vaught. Dr. Vaught, how are you? Nice to see you again.
Keith, thanks for having me on. We're doing really well and looking forward to continuing to roll out the vaccine over the coming weeks and months.
Yeah, talk a little bit as we start, Dr. Vaught, about how how HealthFirst became one of the locations for the vaccine, and how I guess it's been organized by HealthFirst in terms of getting the vaccines out to those 75 and older.
Yeah, great question. So Governor Baker and the State Public Health Department really recognized the importance that community health centers play in the various communities around the state of Massachusetts. And so HealthFirst here in the Fall River community is strategically placed to already provide that service to the members of our community. And so the COVID vaccine is just one additional way in which we can serve not only the patients that come into our building, but the community as a whole.
So talk a little bit about, how many doses are you getting? I mean, that seems to be the question right now, right? How many doses is the city getting, or HealthFirst? How many have you been getting? And what was the process in terms of alerting and setting up appointments for those 75 and older?
Yeah, great. So the state of Massachusetts, we here at HealthFirst continue to get the doses that we request. So what happens is the state of Massachusetts each week puts out a survey to their community partners in the hospitals and at the community health centers, really looking at what is our projected use over the next 2 weeks. And then that survey data is the feedback mechanism for us to get resupplied with additional doses. And so we have been very fortunate here in the early stages of the rollout that as we have set up times for patients to be vaccinated both at our facility and around the city of Fall River, that we have seen those vaccines continue to arrive so that we can get them out to the members of the community.
So in some ways, it's sort of opposite from what we're seeing like on the city side, where they're allocated a number of doses and then the appointments are made. On your end, you're actually making the appointments and then getting those vaccines. Is that correct?
That's correct. So we are projecting 2 and 3 weeks out and really making sure that we've got the staff and the infrastructure to support vaccinating folks, and then putting our request into the state at least 2 weeks in advance so that we know that those doses will arrive. And so we're confident that we'll continue to get resupplied as we move forward through this vaccination rollout.
And how has HealthFirst let the community know that the vaccine is available for those 75 and older? From what I understand, you're reaching out to some of the patients that frequent HealthFirst, as well as allowing people the opportunity to call in and make an appointment, correct?
That's correct. So we have the ability to look internally and at our patient population and our lists and reach out to those patients specifically, inviting them to get vaccinated, answering their questions over the phone, and really engaging that way. And then we are also doing marketing and outreach in the community to let folks know that they can call, they can make an appointment. There's appointment slots available this Saturday for those in our community that are 75 and older to come to HealthFirst and to get vaccinated. They can call our HealthFirst phone number, 508-679-8111, and get set up for an appointment on Saturday.
That's great. And I know in another related move, HealthFirst is working with the Fall River Housing Authority to provide vaccinations and support for those living 75 and older in some of the city's housing authority units, some of the high rises and the like. Talk about how that came about and what's HealthFirst's role.
Yeah, so we're happy to collaborate and partner with the Housing Authority here in Fall River. The ultimately, they approached us through the mayor's office that they had a large number of residents who were 75 and older, and what was the best way to essentially get those individuals vaccinated. Some of those individuals are already patients of ours, but many are not, and so the Housing Authority has done a lot of the legwork to in logistics to get a place set up, to provide the logistical support from a standpoint of organization and making sure transportation wise that those folks are at the location on Thursday. And then we at HealthFirst will administer the vaccine and make sure that it's properly recorded in the database for the state. But it really is it's these partnerships between health and many of our community partners is really what's going to make the vaccine rollout in the coming weeks and months successful. To the healthcare entity, HealthFirst by itself, we can only do so much. But when we partner with some of these community partners, you really can see exponential ability to get the vaccine out effectively.
And from what I understand, those housing authority vaccinations are being held at Our Lady of Light Band, which is literally across the street from HealthFirst. And that's going to be taking place only on Thursdays for the time being.
So we have it set up for this Thursday. That's correct. And so a couple of things that people often, if you go into the doctor's office and you're one patient, you're put into one exam room, and health centers or doctor's offices are often set up for that one-on-one interaction. But when you start talking about vaccinating almost 200 people in a short amount of time frame, the amount of space that we need to deliver the vaccine and then observe those individuals after the vaccine, we just needed a much larger facility in order to do that safely and effectively.
Right. So that's good news for those in the housing authority. And I'm sure that as we move along and more doses are becoming available, that this will all become a little more routine for many people, and then more people will get vaccinated and we'll be at a spot where everyone is comfortable, hopefully, and also where we're beating down COVID-19. Dr. Eric Vaught, the Chief Medical Officer at HealthFirst Family Care Center, thank you for your time as always, and we'll talk again soon. Thank you.
Absolutely.
And thank you for joining us here today on FRC Media. I'm Keith Tebow. Thanks for joining us.